Okay, we're going to start going through my book here, Prevent and Reverse Dental Disease by me, Pete Rogers. This will be the first part. So I briefly mentioned this book about, a couple months ago when I first wrote it, but I'm just starting to get to it. I got so many books, I just kind of go through them one by one. I mostly just talk about the pictures, that's the main thing to remember. A couple quotes here. Hal Huggins, probably the best dentist who ever lived. He said, drill 'em, fill 'em, and bill 'em, and kill 'em. And he's joking because everybody knows drill 'em, fill 'em, and bill 'em, but kill 'em meant that, all the toxic chemicals in the amalgams and the other metals used in dentistry can have negative consequences for patients' health in a big way. And what was Huggins' reward for being the greatest dentist who ever lived? They revoked his license in 1999, and 1996, and he totally gets slandered in Wikipedia. That's what happens to people who try to help the patients. They get in big trouble. That's why no one cares about patients, because if you actually try to help patients, like if you're a genius and you try to help the patients, you get in trouble. That's the way healthcare works. Okay. And then all these phony pseudo-experts will say, oh, no, no, no. All right, here's Robert Gamal. He wrote a great book on dentistry called The Garbage Collector. He said all root canal surgerized teeth are infected. It's impossible to sterilize a tooth. There's too many dentine tubules that can't be sterilized with any technique. Yep, he's right. Everybody knows that who studied it. Okay, Weston Price. Traditional populations eating ancestral diets of plant foods and animal foods almost never get cavities. They've got well-formed dental arches with normal spacing of the teeth, whereas people who eat sweets and flour, white bread, processed food, soda pop, they end up with narrow dental arches and lots of cavities. It was kind of sad. He performed a root canal on his son, who was 16 years old at the time, and the boy died of a complication from the procedure. And then he decided to devote his life. This is Weston Price, the Weston Price, the famous one. And he devoted his life to studying what the heck happened, and he found out that all root canals are infected. There's no exceptions. Okay. He had traveled all over the world in the 1920s and 30s to figure out that all these populations eating old-fashioned ancestral diets, whether it was plant or meat, didn't get cavities. Okay. Okay, then, this was just a silly quote by Arthur Jones, inventor of Nautilus equipment, saying, a lot of dentists, by the way, they got mental problems because they inhale so much mercury. Here's a guy named Murray Vimy. He's the founder of the IAOMT, International Academy of Oral and Medical Toxicology. He founded it in 1984. That's a good website, too. If you want to learn about dentistry, I watch tons of their videos. They're smart. They know a lot. They're trying to help the patients. And they were aware, like, look, they implanted amalgams into sheep and the monkeys, and they can, catch it in the blood and elsewhere. They knew it was going all over the place, okay? All right, here's the basic table of contents of the book, We'll have to first go through some tooth anatomy. You have to know that for everything else to make sense. And then we'll start going through the diseases of the teeth and the treatments for the teeth and all that's involved in that. And then later on, fluoride. Okay, here's a disclaimer. Basically, I'm not your doctor. I'm just teaching here on YouTube. You got to work with your private doctor, especially because if you start adopting these healthy diets, your blood pressure is going to drop, your insulin sensitivity is going to go way up. So if you take your old doses of medicines, you're going to, pass out or something from hypotension or hypoglycemia. So I said, I'm not your doctor. What does it say here? I think it usually says something like, I'm just a mope who writes books because I have nothing to do. Also, if you're on anticoagulation, when you change your diet, your anticoagulation med dosages might need to be changed. This book's for educational purposes only. Okay, so how can this book help you? Well, you'll learn how to take care of yourself so you don't end up being another sick chump. I'll go through everything that sort of happens, okay? And then dentistry, it's been described by Hal Huggins as well, that it's like a Trojan horse. They tell you silver fillings, and they're really putting mercury in your mouth. Here's a nice painting, Trojan Horse by Henri Paul Motte, 1874. Beware of Greeks and dentists bearing gifts. That was first said by Virgil in the Aeneid. Okay, here's tooth anatomy. How is most dental knowledge passed on? By word of mouth. Okay. So the part of your teeth that you can see in the mirror is the enamel. That's the white part of the tooth. And then the bulk of the tooth is sort of this middle part called the dentine, like dentine gum. And then the roots are the part down here, and that's where the blood vessels are going to come in. So this is the crown, the enamel is the crown, and then the root is down here. Okay, so each picture is going to add a little bit of anatomy. The artery comes in at the bottom, the vein goes out through the bottom, the nerve comes in at the bottom, and this is the pulp space. This is the living part of the tooth. The tip of the root is called the apex. That word's going to come up a lot. This is what makes the tooth alive, that you have the pulp with the arteries, the veins, and the nerves. Okay. Now this is called the root canal, where the arteries, the veins, and nerves are located. This right here is called the dentine, or sometimes it's called dentin. The E on the end is optional depending what country you're in, but this will have lots of tubules that are coming out. I'll show that in a moment. Okay, so here is what is called the cementum. The cementum is located between the tooth and the PDL, the periodontal ligament. And the periodontal ligament attaches the tooth to the jawbone. The bottom jawbone is called the mandible. The top jawbone is called the maxilla. And this is very important. If you get a tooth extracted, you have to remove the periodontal ligament. That's really important for it to heal. You have to remove the periodontal ligament. Not all dentists know that. And if they don't know that and they pull a tooth, it might get infected. Whereas if you clear that out, it's usually going to heal pretty good. That's actually very important to know. Okay, now here's just a little more anatomy. Here's the periodontal ligament drawn thick. I don't have the cementum drawn in on this one. This is the gingiva, and this is just how it works. So if you have an infection that spreads through the tooth, it'll often go into the bone right next to the apex here. Okay, that's it for today. Later on the next time we'll go through the nomenclature, how you name all the individual teeth. Hope you found this helpful.